Good morning, good afternoon, and good evening, wherever you are. Thank you for our next episode of Master the Product. Our topic for today is how to build responsible AI products in healthcare. And to help us go deep into into that topic, we have Archie Mayani. Archie is the Chief Product Officer at GHX. She has over 20 years of experience in digital health, medtech, product innovation, and previously held leadership roles at Change Healthcare, Amazon, and United Healthcare. As for me, my name is Mustafa Kapadia. I help product organizations use AI to be more effective and productive, and you can learn more about me at echo-point.com. Archie, I'm so glad you're here with us. Thank you for joining us.
Likewise, that was lovely. Thank you for having me here.
Yeah, thank you. I'm glad, you know what, when we first connected, I'm like, listen, you have to come to our podcast. So I'm glad we finally made it work with our schedules.
Likewise.
If it's okay with you, let's just dive in, yes?
Yep,
By the
let's do
way,
it.
so let's start from the top. If you don't mind, tell us more about GHX, right? It's a huge company, but very few people know about it. What are the trends that you're seeing in the industry, and where AI is helping you?
Okay,
Impacting the industry.
from the top, three questions in one, like that's your style, and I love
That's
it.
my style. We start really high level, and then we go deep.
Wonderful. Well, so who are we as GHX? I like to often describe GHX as the best kept secret in healthcare, and here's why. We have over 95% of the medical surgical spend going through our core exchange platform. So if you think about it, it's really the backbone of the entire ecosystem. Not very glamorous, but certainly mission critical. Um, every syringe, every PPE, every implant needs to get seamlessly through
Yeah.
from the manufacturers to the suppliers to the providers and ultimately to the patients, right?
Yeah.
So at GHX, that's where we truly sit, right at the intersection of all of these players. And our job is to make sure that the right product gets to the right point of care at the right price.
Mm.
That really sums us up. And it's truly our mission.
Yes.
Quality and affordable healthcare for
Yeah.
all. And then
You know
you
what?
said, trends.
Yeah.
What are we seeing as trends? Because we do sit at a very unique juxtaposition in the healthcare industry. And I want to start with this for your listeners. The one singular macro trend that has been developing over the years, but kind of just rapidly got exposed during the pandemic is this. Healthcare supply chain has been going through a fragility crisis, if you will. And
Mm.
right now, there are about three different super forces that are colliding and making it worse.
Yeah.
So, the first one, think about where your care is shifting to. It is no longer about just hospitals. We are getting care in our ambulatory care centers, in retail clinics, even home based care, right?
Right.
About, I want to say about 25% of the care today actually happens in non acute settings. So that makes the supply chain footprint
Yeah.
even more complex and more non traditional than what we are used to,
Mm.
right? Second, think about the global disruptions, right? The pandemic, we thought, oh, it's a one time event. It happens in 100 years.
Yeah.
Guess what happened after in the last 5 years? We've seen geopolitical tensions,
Yes.
we've seen events led through climate change, shipping delays, bridge collapses, you name it, you have it. And so our industry as a whole has been it's coming to bear that we have to find new ways to adapt and be
Yeah.
resilient, right? And then third, right, like this is universal. The cost pressures are mounting higher every year. If you think about the inflation in healthcare, it's about 6%. 6%, which really overtakes and outpaces all of the broader economic implications that we see.
100%.
And
Yes.
30 to 40% of the hospital spend, guess where it is? It's your supplies. So
Wow.
those are truly, if you think about the macro forces, like that's what is at play.
Yeah. That's amazing, and you're absolutely right, because we think about the pandemic as a one-time event, but it did expose a lot of other things that we were just either things that would work better before that, or just expose a lot of seams, right?
Yeah,
And then it has just gotten worse and worse with all the different market forces and the political forces that are happening in the world, right?
exactly.
Interesting. So I love the framing, right, of what GX does and what are the how the macroeconomics are shaping the industry. Now, in all of this stuff, you add this thing called AI,
Mm,
right? And
yep.
now the AI can be both an opportunity and it can be also a disruptor,
Hmm.
right? So I'm curious, what are your thoughts about how AI is impacting you and your industry?
Yeah. So, certainly, first, let me start with this. We are not new to AI. Like
Right,
we've been using technologies like OCR and classic ML and AI even before it really gained prominence in
right.
our, pop culture, if you will, for the
Perfect.
last 4 or 5 years. Um, However, I will say this, what we are doing different, or maybe say what is new, is how we are connecting the dots and our approach to making that, what I talked about earlier, that fragility, the only
Yeah.
way to tackle that fragility is actually through developing resiliency, which has to
Yeah.
be more proactive, uh,
Hmm.
less reactive. I mean, there is going to be some reactive component, but more proactive. And I think instead of just data driven insights, I think the conversations have shifted to, can you aid me in making decisions, give me recommendations, but also, abstract away some of the non-value added work for me. So I
Right.
think that is the sort of the newness in how we are approaching and leveraging the
Interesting.
technology. Like, let me give you an example. Historically, um, a shortage would happen somewhere because something's, a
Yeah.
truck was moving the supplies and, blew up on 101 freeway, and now we don't have those supplies. What is the hospital going to do, and how are we going to handle it? We'll scramble. Now we are going to actually flip it. We have AI, so now we can use predictive deterministic models to actually flag shortages even before it hits, uh,
Hmm.
even before it hits the system.
Right.
We can prioritize back orders based on patient risk. So a
Interesting.
critical stent, right, reaches the OR before like a box of bandages, right? Because not all
Of
supplies
course.
are created
Are
equal.
equal. Yeah.
And then we can also, with AI, I think scale is where I think you gain the biggest advantage. I think we can uncover systemic friction, things that humans alone can't see at scale. So really that's the shift, that's the opportunity where
Yeah.
building more resiliency, developing more foresight, if you will. I think
Interesting.
we can stay one step ahead of
Yeah.
all of these disruptions.
But see, I love where you're going because you are talking about a massive shift in just the way you operate,
Yep.
right? And so, in order to do that, even the products that you and your team are building have to go through a massive change because now you're talking about massive amount of data to even predict and diagnose a potential incident, and then being able to counteract that, right? So, I'm curious, just within your product strategy portfolio, how are things changing? Are you thinking about new products? Are you thinking about revamping old products? And in what way? Right?
Yeah, we are. I think I'm going to build on the theme that I introduced earlier. I think we want to give organizations superpowers.
Yeah.
Not just dashboards, more data. Of course, we are the trusted, arbiter of data. We
Right.
have for 25 years, but we want to leverage that data to actually aid them to make better decisions. We actually launched something called as GHX Resiliency AI on July 14th. There were
Huh.
three different solutions underneath it. And what it does, it's constantly scanning millions of signals across the supply chain so
That's perfect.
hospitals can spot risks early,
Right.
prioritize back orders, or things that are critically back ordered, um,
Mm-hmm.
or even predict where there is a risk, a clinical high risk, or
Yeah.
criticality that can impact severe delays in care. And then also look at the personalization aspect of the providers, where a particular supply goes into back order status, but
Yeah.
you already have other supplies that have been identified in that event, and they are compliant and safe to order. So let's make sure, if they are in stock, make those recommendations early and often, that hey,
Right.
this one's going to be back ordered, consider your alternatives in the near neighborhood. So I think that's what we are doing with more deterministic and classical AI, if you will.
Mm-hmm.
And then I think the other piece of it, are we building new things? So yes, we are taking it a step further with generative AI.
Yeah.
Um, I want you to picture a supply chain leader, right? Looking at the dashboard that he would have looked at, 6 months ago. He always had that dashboard, and he was digesting data, understanding, what suppliers are actually
Right.
delivering on time, which ones are not. But now we actually have a copilot experience
Okay.
where it really aids them to not just, show them a bunch of data and maybe fewer insights as well, but also helps them make decisions. Okay, these three suppliers, they are really jumping onto the top of my
Right.
problems, and I actually need to write an email and schedule a call with, here are the three things I want to achieve in
Mm.
quarterly business review.
Yeah.
So that's where it really is heading. So it's not
Yeah.
simply about taking all the dazzle buzzwords, but actually making this part
Yeah.
of the way they work daily.
Yeah. And I like the blend that you're talking about because, some companies are only focused on the deterministic part of AI, and others are saying, okay, everything has to be generative AI. But there really is a good blend between the two because both of them can help
Yeah,
each other, right?
I think even more than the blend, I think it's that last piece, right? You have to start with customer back. What
Yeah.
is the value you are trying to deliver? Because if you
Yeah.
get caught up in building technology for the sake of the elegance or excitement, then you kind of have reports.
100%.
The one that came out, a few weeks ago, the MIT report, where 95% of these AI initiatives actually fail to
Yeah.
deliver the
Yeah.
ROI they promised. So
Yeah.
it has to start with the value you're trying to deliver, and
Yeah.
walk back with that workflow in mind.
Yeah. I 100% agree. I mean, always start with the user first and then figure out what is the right way to help them do their
Yeah.
job better. And that usually is the good mantra. I'm curious now that you're using both, because remember, and you know this as well as anyone else, when you build products with deterministic AI, it's a very different type of a building experience
Yep.
versus when you build something with generative AI, which is much more probabilistic, right? And so, how do you do that? So, I'm curious, how are you and your team building AI products with generative AI, right? Because I'll tell you, every CPO I talk to, they all struggle with the same thing because they're trying to build reliability and predictability in a model, a large language model that inherently isn't.
Yeah. Yeah.
um, and especially with your industry, where it is so much critical that you get the supplies in time to the patients that really matter, right?
Yep. That is, you're right. I think, when a dating app hallucinates, it's kind of a funny telltale story.
Yeah,
Um, but for us, it really is a matter of
yeah,
life and death in a lot of
yeah,
situations. So yes, we have to build responsibly, and I think that's where I think I would actually start with how we are thinking about this. For us, I think it's not just building AI products responsibly, it's
yeah.
actually building all
And
products
product responsible,
responsibly,
yeah,
right? And so it starts with the context, and the context is simply what you said, the user, the customer, what problem are we
right,
solving, who are we solving it for, and
right,
what happens if we get it wrong. I think that last question is so critical in our minds
yeah,
as we are doing design thinking sessions. before
Mm,
we write a single line of code. And that is like AI agnostic, right? Doesn't matter what
100%. Yeah.
technology we use.
Yeah.
And so, the mantra that we have is about what we like to call jokingly riff on MVP, like minimum viable trust approach
Hmm.
before we scale. And, in practice, it actually looks very, very tangible. What it
Hmm.
looks like, the first things first, we are going to make sure our models are explainable.
Right.
It cannot be a black box. It cannot be a black box to us, and it cannot be a black
Yeah.
box to our users.
Yeah.
So let me give you an example. For example, when the GHX Resiliency AI flags a backorder risk, it shows you why you should consider this
Yeah.
particular item. What is the
Yeah.
supplier shipment delay would look like? Where are
Mm,
the spikes in demand? What should your alternatives be like? And I think there is an explainability versus
yeah.
guessing the why,
Yeah.
right? Why is
And
this
it's so
something?
critical. I think so many people miss that explainability, right? Because I was just
Exactly.
talking to another product team a few weeks ago, and they want to build all of these great things just on a dashboard so people can extract more information. Of course,
Yeah.
not in supply chain, but in a similar concept. And
Yeah.
like you can't treat this like a black box. You have to give people choices,
Yeah.
and you have to tell them why these things are the way they are. Otherwise,
Exactly.
they're never going to trust the system, right? So
Exactly, exactly. And I think that's the other piece, right? Like you can, in your example, you may have the perfect visualizations in the dashboard and you may have like this
yeah,
beautiful Gen AI treated summary. But if you're not explaining where you are pulling this and why this is coming up, it
yeah,
kind of doesn't allow you, like that lack of transparency in healthcare will actually not, will it will reduce your adoption.
yeah,
I promise
100%.
you,
Yeah,
AI or not, right? So I
yeah.
think transparency is very, very important. And then I think the other big piece for us, and I know a lot of people actually talk about this, but they're always in a rush to gain full automation. For us, keeping humans in the loop for decision
So
making,
important.
how we
Yeah,
how we are building for the next couple of years,
yeah,
even. For us, the expertise of a clinician or a supply chain leader or a finance manager, we're not here to replace it. We're only here to augment it. So
yeah,
while the perfect order dashboard copilot will have you look at the insights where it highlights the discrepancies in the system,
hmm,
but ultimately it is still up to you, Mr. User, Mr.
to make
Supply
the
Chain
final decision.
Manager,
Yeah,
to prioritize and resolve issues. It can
yeah,
make recommendations,
yeah,
but we are keeping that frontline judgment
yeah,
super critical and very much
yeah.
relevant in how those
I
decisions
I
get taken.
absolutely love that insight because so many people miss that critical piece that you just talked about. They almost automatically jump and say, "Well, let me figure out how I can take human out of the loop." And
Yeah,
I think it's the opposite, right? It is about human AI optimization or human enhancement or
yeah,
assistance or whatever you want to call it.
yep,
But in reality, the technology is there not to replace, but to enhance that experience or enhance that
exactly.
decision making or make them look at the same problem from a different point of view that they never had the opportunity to do that.
I
And
love it.
that's
I
when you
think
start
that's
delighting the customer, right?
that is really the motto that, let's show them different facets of the problem that they may have not looked at it
Yeah,
before.
yeah,
And I loved what you said, right? This idea of complete automation. Look, I want to do it, but I think there are workflows that it will just not make sense.
yeah,
We have other managed services and we do other non-clinical, non-judgmental tasks.
right.
Those can be automated away, but again, where I think you have a patient in the picture, we're going to leave that judgment to
Yeah,
the experts.
100%. And you need to have a fail proof, right? And
Yeah.
more importantly, if you have a human in the loop, the engineering part becomes a bit easier too, as opposed to full automation. So you
Yeah,
can go much faster.
that piece of, talking about the engineering part, I think for us it also comes in with, some of the compliance standards, right? Like, are we building things that are compliant with HIPAA mandates, with PHI, patient safety, and
Yeah,
also hospital operations? They themselves have so many compliance standards and ethical best
yeah,
practices to go to.
yeah.
So that is the other piece where we actually do have something called as the AI Governance Council. So we will not, and it's a cross-functional expert
Perfect.
group, and we
Right.
will not launch anything. I mean, truly speaking, in a layman's language, like, we will not ship unless we know we would be ready to use it
Mm,
for families as patients. Period.
perfect. Perfect. I love where you're going. Do you mind if I actually just go a bit deeper, if that's okay?
Sure,
So
sure, sure,
the
sure.
example that you talked about is you really using AI to enhance the user experience or the supply chain manager's
Mhm.
experience to help them give them insights, right? But I'm
Yep.
curious, are you using AI or at least generative AI on the back end too to just analyze different pieces of data to even identify or monitor or predict what's going to happen? Because a lot of people are using it depending on which industry you go to. Some people use it only in the back end, some people only use it in the front end. I'm just curious what you guys are thinking.
So we use it, not just generative AI, but even classic AI. So we
Yeah.
have, let me share a couple examples. So we do have a data quality tool. We call it the
Mm,
Data Quality Studio, which we are just looking at, like, multiples of, items and
right.
categories in a catalog, and actually matching them to make sure that we have the best attributes associated with that item and with those categories. And the fastest, most easiest way to do it is through AI.
Mm,
So we do have that kind of sort of internal tooling where we leverage both AI and Gen AI. And then, we also, like most other companies, we do have um, opportunities where we are looking very closely to how do we actually enable our customer CX team, customer operations,
right.
customer experience teams, to leverage more as a knowledge base, which is something very, very common. Like, one of the first projects we did was, cheekily, we called it Chat GHX. So it's really, your Chat
Yeah.
GPT, wrapped
Perfect.
around and trained with our own data. And that's huge knowledge base for us. And so our customer operations team can pretty much, and other functional areas too, they can go in and actually quickly query for the information that they are looking for, and even
Right.
sometimes synthesize and collate it in different ways, very
Okay.
similar to what you would expect on Chat GPT.
Yeah.
So yes, I think the answer is yes, but certainly for us, we are hyper focused on how do we deliver customer value over our own internal efficiency and
Yeah.
savings.
That's great. I love that. I love that perspective too. If it's okay, I'm going to go a bit deeper. I told you we're going to go deep.
All right,
Um,
I'm ready.
in order to do this, right, you need to actually have the right product team because you remember even the product team, the way they build products has to change. So how are you actually um, helping a product team kind of move from the needle of being just
Mhm.
building generative AI is a very different way of building products than the old than the large sorry when than the way that we used to use AI before, right? Which is very deterministic. So I'm
Yeah.
curious how your team is adapting or how you're helping your team adapt to this new paradigm.
Yeah, yeah. I think one of the things, I want to say that, I wish I could say that we are fundamentally doing things different, but we are actually not. Heading
Mm,
back to that point of, we always have to build things responsibly. So,
100%.
you know,
Yeah, some
the
things don't change, right? So you're right. Customer first, user centric, even design thinking, none of those things change.
exactly. So I think it starts with that design thinking. But I think what we have done is we've taken our very deep rooted philosophies of design thinking and the mechanisms that we've always had, working with our co-creators, whether it be our partners, our distributors, or our customers. um, we've created sort of a 3 E's framework. We
Yeah.
call
Oh,
it
makes sense.
explore, embed, and elevate. So And again, it will sound very similar to the design thinking principles. So
Yeah.
something groundbreaking, but I think it gives us a good sort of a stage gate process of, how we move from one stage to another. So in the explore phase, obviously we are sitting with real problems alongside our customers and clinicians, and we're listening deeply, we are understanding their pain points before we dive into writing a single line of code. Like,
Right.
there is just no way we are going to do it. Then once we understand the problem, we are actually going to start looking at embedding these solutions in real workflows. Let me give you an example. So when I talked about earlier the GHX Resiliency AI, as we were exploring the problem, like, hey, so you have almost 60% of the things that get back ordered and disrupted
Hmm.
each year. Um, Tell me more about the problems. How are you, prioritizing these items? What would you
Right.
like to have it prioritized? So we did exploration and experimentation with, putting like a basic model together, right? Of where we want to, how we want to actually surface the data and the
Mm.
insight. And then the recommendations, we're not thinking about it yet, just the insights
Right.
and that sort of that predictive modeling aspect of it. And then we are actually inviting our customers to kind of almost test the model for us, that look,
Right.
here's what we've come up with using your data. This is what we are predicting as to how these supplies might get disrupted.
Mm.
We're also attaching a confidence score around it.
Oh, perfect.
And then, we actually, at the time, like the first iteration, we didn't put the clinical sensitivity in. So we got the
Mm.
feedback from the customers directly saying, hey, this is good, but it's actually not going to work for us because a box of band-aids is not the same as PPE.
Yes.
We're like, okay, you know what? We need a clinical sensitivity score that needs to be a big output from the model itself, right? So then we are retraining the model, rejiggering it almost, right? That's when once we get the confidence from our customers, we're like, okay, now we need to start thinking
Yeah.
about embedding this into the real workflow that they have today, right? That's when we start driving that solution with our customers, co-creating it, and then actually testing with
I
them. So
love
that's where the embed piece works.
I love the fact that you're actually inviting customers into the process, which is so critical. So many teams don't do it, and this is classic 101 product development, right?
I'm
Um,
glad you said that, right? I feel like when I hear product lead management or product development, doesn't matter how we think
yeah.
about it. Like, if you don't have 5 to 7 unaffiliated customers who are like, I want this and I'm going
Yeah.
to be a partner, I'm like, that's not your burning problem then to solve, right? Even
100%.
for commercial
Yeah.
reasons,
Yeah.
it's not
You've
a
cut
burning
through so much, quote unquote, internal prioritization by understanding that. Because if they're not willing to give you their time, then you know it's not worth solving. And
That's
the other thing that I like that you've also flipped on the head is this idea that, yes, generative AI is inherently unpredictable, but by surfacing that unpredictability in a type of confidence score,
yep,
you're actually using its some of its negative inherent weakness into a strength,
yep,
right?
exactly.
And so you're turning it out. So that transparency just makes a huge amount of difference, right? And so many people try to hide that piece, but by surfacing it, you actually build more confidence and trust into your products,
Remember,
right?
we can't give a black box to our clinicians.
Yeah. So I love that. We're almost out of time, so I'm going to have two more questions, if that's okay with you. As you're doing all these things, I know we talked about teams, but are there any other challenges that you've had to overcome, or as you've been building these products, what has been the biggest challenge that you've needed to overcome?
You know, probably a cliched answer, but the truest one, I think it has to do with the messy data.
Mm,
The healthcare data is so fragmented, so inconsistent, and so many edge cases to be worried about.
yeah.
Um, it's just hard. Like it's a continuous data management activity more than, like, can we get a clean set of structured data to even before we start getting
Yeah.
into model development. So I think that is definitely one
Yeah.
of those.
100%.
Um, and then I think the only other thing I would talk about is kind of like overshooting the hype curve, right? It's
Mhm.
very tempting. Everybody wants to sprinkle AI and everything. But we talked about this. Like, we are not the industry to where we can move fast and break
Yeah.
things. So, that idea of not ever compromising the quality, taking that extra quarter to work with your customer, making sure that it meets the bar,
Mhm.
um, I
Yeah.
think that is, it's like that right balance of, time to
Yeah.
value to time to market.
Yeah.
I think that's
100%.
always front and center for us.
I love that answer. One last question, and this is on a more personal side. I'm just curious how you are personally using AI, either for work or for fun,
Oh my
and if there's
gosh.
anything that I like to share. So
Okay, I use AI every day.
that's good. That's awesome. Not a lot of CPOs do that on a daily basis. You'll be surprised.
Are you sure?
Yes.
Okay. Well, I do. For work, I think it's my thinking partner. I
Perfect.
can think faster. It gives me sort of a filled canvas, whether I want to pressure test some strategy or learn quickly at a high level on any new topic like that. It's great. It just helps me move faster.
Nice. Yeah.
I think on the personal side, I have two kids, so I
Yeah.
see my son uses it to have these endless debates and arguments with my husband on linguistics. And then we also use it to plan or I use it to plan our family trips and vacations.
Yeah.
But I think, yeah, I think if I had to think about how I think about AI, two things, right? Like, I do feel like some of the things, I'm like, how did I actually do this before having having
Yes.
an AI? So I do think that it's kind of really integrated in part of my life. But then I think the other thing I do tell this to my children, right? Like, don't treat it like a vending machine for
Yeah.
answers. I think you have to
It has to be
collaborate with it.
critical and yeah.
Yeah, you have to
Yeah.
collaborate with it. And again, ultimately, it's your line of judgment that is going to be most important versus outsourcing the decision
Yes.
making. You know
Yeah.
what I mean? So
Oh, no,
that's
I 100%. I think I think the first thing you said, that it really is a good thinking partner, and that's what it is. It's a thinking partner, but it's not a decision-making entity, right?
exactly,
And those are two
exactly.
very different things. I'm curious. We actually use AI. Well, I'll talk on the fun side. On the personal side, I use AI like everybody else. I use it every hour. In fact, I always run out of, even though I have all the, even though I have all the paid subscription and stuff, I always run out of tokens. um, but have you ever tried? So we did a vacation with the family last time. I actually built a digital twin profile for all
Hmm,
of my family members,
interesting.
and then I used that to actually plan a vacation, and it came
I
back with
haven't
such
done
a great
that.
idea.
I haven't done that. And so that means that, you have these profiles saved, and every time you want to, like, say you want to plan a birthday for one of your children,
Yeah,
you don't have to give extra prompts. They already know what they
they
like,
already know.
what they
Right.
dislike. Wow,
Yeah,
that's so smart. You
yeah.
taught me
And
something.
I mean, I use digital, or we use digital twins, everything. So all our clients and customers, we build digital twins, or we help them build digital twins for their customers, for their vendors. Even I had a CPO who built a digital twin of himself and gave that to his team, because he's like, if
Wonderful.
you have questions that you want to ask me, here's a digital twin. That doesn't mean that you don't come and have time and spend time with me, but this is just another person, just in case, late at night you have like, what is Eli think? And by the way, I can use his name because he actually made this public in the last podcast. So I'm like, what does Eli think? And they can use that. So there's a lot that we can do, especially I
Yeah.
wanted to build on that thinking partner piece.
Hmm.
Um, we have others in which they've built digital twins of their competitors. And so now when they're about to release a product or change a price, they actually use to figure out what's going to happen in the market to think about second order pieces. So there's so much that you can do in this area. It's amazing. We
I'm
just
going to
got
experiment with it. I promise. That is
100%.
it's
Trust
my
me, it's
favorite.
I personally use it all the time. Like I have, believe it or not, I have a digital twin of my own business and company. And so it has all my P&L and all that stuff. And I actually then use that to
That's
figure
amazing.
out, where's, do analysis on my P&L, but also kind of do a prediction about, okay, what's our cash going to look like by the end of the month, the end of the
Mhm.
year. And so there's tons you can do. It's just a matter of building the right context.
I'm
And
with you. I'm with you. I'm already thinking like it can actually even generate leads for you depending on, what your strategy is, as long as, you've given the guardrails and the parameters. I think it can do
yeah,
so much for
it
you.
can. It is a very powerful idea that we've been using for quite a few of our clients, and it does change the trajectory because you're like, oh, wait a minute. Like you talked about bringing customers into your process, right?
Mm-hmm.
You can build digital twins or synthetic users of your personas and have them actually even validate an idea before you go to them. So that now instead of giving them 10 ideas, you have 3 better flushed out ideas.
So
And it's just
true.
easier,
So true.
right?
And I think this is where we can actually, like, my wheels are turning, Mustafa. I'm thinking this can actually elevate my design function, right? Like you already,
100%.
whether you call them digital twins or whether you call them user personas, like it's an elevated,
Yeah.
more richer, denser
Yeah.
user persona that can do things for you,
Yeah.
almost like a user persona agent. Does that make
Yeah.
sense?
That's exactly what it is. In fact, we actually have a client right now. They have a really deep bench of user research, right? They
Mm.
have a great user research team, but like anything else, they're overworked. They don't have enough time. And so product sales, marketing keeps reaching out to user research to figure
Mm.
out, how can I bring in a much more user-centric point of view? And so now they're using digital twins to unlock that research. And so say, oh, you want to talk about so and so? Here's a digital persona that you can talk to, right?
It's on
And
demand.
so it's just changing the way they're using
Yeah.
this idea. And again, like anything else, it's you take it with a grain of salt, right? All it is it helps you think things through or think about second order effects, which is so
Mhm.
hard for people to do,
Yep.
right?
Yep.
If I do this, how is this person going to react? If I drop the price of my product, how is this competitor going to react, right? And it just gives you ideas and things about these. So it's just, I mean, we're just scratching the surface, Archie. I love, there's just so much that we can do.
There
Uh,
is truly.
so I would love to come back, and if it's okay with you, I'd like to get you back in about 6 months to a year and see how your journey is going on the whole AI piece. Because I
Well,
think
you
the
have to
way you're
quiz me
building
on
it is
the
fascinating.
digital twin piece, and then I can tell you how I'm using it.
That's perfect. Well, I'm happy to do that.
Awesome.
But thank you so much for being a guest. This has been fantastic.
Likewise.
Yeah.
Thank you for having me, Mustafa. I
And
enjoyed our conversation and I learned so much more.
perfect. Then it's a good even take and take then.
Bye.
Awesome. Bye for now.